Welcome back to the show. In today's marketplace, reversing type 2 diabetes. Our next guest says that with the right treatment, it can be done. Here to explain is Dr. Craig Hartman. Thank you so much for coming in, Dr. Hartman. You deal with a lot of people, and anyone who would ever say, oh, I don't think you can do this without a medication, you would say that's wrong because you're seeing it happen every day.
Oh, you bet. Yep, we do it in our office, and when you take the right approach and really look for the underlying cause of the diabetes, you can reverse that condition.
So you're working on this, but at the same time you're seeing type 2 diabetes go up over the years. It's continuing to rise.
Exactly. With traditional care for type 2 diabetes, what happens is the medications are used to just address the symptoms of the disease rather than get into the underlying cause. And because of that, people are typically diagnosed with type 2 diabetes and they get worse over time and they're a diabetic forever. And because of that, the numbers just keep growing and growing and growing.
And I suppose the way Americans eat isn't helping any.
Oh yeah, the standard American diet and the stress levels make us all very prone to type 2 diabetes. It makes fertile ground for that condition to develop, for sure.
So what is different in your clinic, and what do you provide that's different than other clinics?
What I do is much more extensive testing to find that underlying cause. So with traditional care, typically you get blood sugar and hemoglobin A1C, and you're diagnosed with diabetes, and then you start on medications. Well, what I'm going to do is do much more extensive testing looking for the underlying cause. So we're going to look at digestion. We're going to look at hormones, reproductive and adrenal hormones. We're going to look at liver function, thyroid function. We're going to look at all these different areas. And then we find that underlying cause. When we find that underlying cause, we start to put together an individualized treatment plan to address that cause. And that's when the real magic starts to happen. You start to see a reversal of that condition.
I have to imagine that's great for patients who come in because they're really frustrated when they come to you.
Oh yeah, it's a lot of fun. It's a lot of fun because people come in, they're frustrated because what happens is they get diagnosed with diabetes and they start with a medication. And then over time, they have to increase that dose. And then pretty soon they're on another medication. Then pretty soon they have high blood pressure. They have high cholesterol, high triglycerides. And they're on all these medications that just keeps growing and growing. And over time, they start to realize, you know, I'm not getting better, I'm getting worse. And nobody's told them why they have it, and nobody tells them what they can do to reverse it. So it becomes a very frustrating situation for them, and that's what we address, is answer those questions.
So what kind of results do you typically see?
Well, we get great results is when people come in and we find that underlying cause and we address it. That's, like I say, that's where the magic starts to happen. So we start to see their blood pressures lower and stabilize. Their hemoglobin A1C goes down. We start to see their blood pressure go down. Their cholesterol goes down. Their triglycerides go down. They also get more energy. Many type 2 diabetics are very fatigued, and so they'll see their energy increase tremendously, and they start to lose weight without exercise.
Wow. When people come to you, do you say, oh, this is not appropriate for you once in a while, and people do need medication, or do you find that it's appropriate for most people who come to you?
Well, yeah, I find that, you know, there's all types of different levels of type 2 diabetes, or where people are at, I guess you could say, in type 2 diabetes. And so, yeah, this is going to be more appropriate for some than others, but especially people that are really having a hard time with the condition, they're getting worse. This is appropriate for them because they need to find, or we need to find, that underlying cause to actually reverse it and stop it from getting worse and continuing to worsen.
We probably should make it clear that this is different than type 1 diabetes.
Right. Type 1 is an insulin-dependent diabetes. This is type 2. And type 2 is not insulin-dependent. They may have progressed to the point where they need insulin, but type 2 can actually be reversed with finding that underlying cause and appropriate individualized program for it.
How young can your patients be?
Boy, that varies. Most of them are going to be older. You're going to see more people, especially over 40 or 50. But you know, I think my youngest patient is 33. You know, it's an adult, typically an adult onset diabetes, but they can be, like I say, 33 is pretty young.
Pretty young, yes. Yeah. What kind of offer do you have for people? We're going to give people a phone number to call for more information.
Exactly. What they can do is call the number, and for the first 20 callers, What we'll do is we'll sit down, we'll have a free consultation and go through their condition, really discuss where they're at, and see if this would be an appropriate fit for them, a right program for their condition.
Great. Well, thank you, Dr. Hartman, for all this information. Really good. And we've had the number on the screen. We're going to give it to you as well to find out how Dr. Hartman can help you with your type 2 diabetes if you have it. And more information, call 952-681-2916.